Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Friday, February 5th, 2021. Well, cases are continuing to trend downward just about everywhere. Worldwide, we saw 3.4 million new cases this last week, which is about almost 500,000 fewer cases than the week before. Here at home, we saw less than 1 million new cases for the first time in many weeks. So it was about 900,000 cases, which is about 300,000 cases here in the week before. Massachusetts still be more or less held even with about 29,000 new cases. In terms of deaths, things are still more or less holding steady there. Worldwide, we saw 93,000 new deaths from COVID-19. Which is about 7,000 fewer in the United States, about 22,000, maybe a couple fewer than last week. In Massachusetts, 436 people died from COVID-19, which is about 6 less than the week before. So we might be beginning to see some beginnings of drop-offs there. So we'll see here. So in terms of daily tests are still kind of trending downwards, but cases are dropping much more. Everything is trending downwards right now. We'll take a look at each of these in turn. When you look at things week by week, you can see that while we are still in one of the deadliest weeks of the pandemic, in terms of cases, things have dropped precipitously. We are now, right now, in the late October level of cases. So that's a long way from where we were at the beginning of last month. Hospitalizations also down there. You can look here, you can see that since January 12th, which was the height of the pandemic in terms of average cases per day, while testing has dropped about 12.7%, case counts have dropped 47.5%, looking at 7-day averages, which are, of course, more representative than any individual day, which can be thrown off. So things have dropped quite a lot since there. That said, we are still pretty high compared to where we were in the summer, but there's no state in the last week which had a 7-day average of more than 20,000, which is another progress point there. See, California and Texas are still going to be putting out big numbers for some time, but things are trending downwards. Now, these are, of course, raw numbers, not the adjusted for population. So some states that have fewer cases may have more by their standards there. But as we look at all the different regions as they are starting to come down, we can see this chart shows the different census regions broken down a little bit more specifically, and how their weekly case counts per million people have varied with, that the week of January 7th was the height for most of the country, with the exception of the Midwest, which has already passed its peak by then. And now everything is trailing downwards, getting us to early November, late October numbers for most areas. But that said, we are still about twice as high in terms of case counts as we were in the summer surges, just in any specific area, and also as a country as a whole. In terms of hospitalizations, we have, again, continued to drop over the last couple of weeks, where we've just reached the point where we were basically around Thanksgiving. Again, still far and away, 20,000 more than we were in the spring or summer surges, but we are steadily making progress there. Different areas going faster than others. This is, again, breaking down those census regions into their component parts, and you can see the regions that have dropped the most, especially Pacific West, has really come down a lot there in terms of raw cases numbers there. But by population, the eastern part of the Midwest has dropped a lot there as well. And while the South Atlantic region still has the most people in hospitals, it has dropped a lot just in terms of raw numbers, even if that's not a significant percentage since January 1st, because they were still on a late rise there. Up here in New England, we haven't seen as much of a decline, but in terms of raw numbers, but again, we don't have as many people in hospitals as any other region in the country does. So that is still a significant percentage reduction by our standards there. And working our way towards getting our hospital systems to a point where they can comfortably handle any new cases. Deaths still holding fairly steady there, maybe the beginnings of a drop off, maybe next week. We may see some beginnings of decline. The drop-offs in hospitalizations and case counts, especially drop-offs in hospitalizations, should lead to a drop-off in deaths fairly soon, and hopefully we'll begin to see that shortly. All right, in terms of developments, a bunch of interesting stuff here, a lot of new studies coming out this week with some new information on the pandemic and new strategies for the future. So first up, a couple of thoughts on strategies with how best to work the vaccines. First up, there has been some new data on when to give second shots, especially with the AstraZeneca vaccine, which of course we're not going to see in the United States for some time. But there has been increasing research suggesting pushing the second dose as far as 12 weeks out. So besides the fact that this means it's easier to give more people a first shot, you can certainly cover more ground that way if you're giving everyone first shots now and getting that around 50% protection sooner to more people. It also means that delays are not going to be risky. You know, people getting a shot 12 weeks later may actually have increased, for at least the AstraZeneca vaccine, have increased protection they would than getting it earlier. Now, this is not necessarily true of the ones we have here, the mRNA style vaccines, which it's waiting a few extra weeks to get from, say, 95% protection with the Pfizer vaccine to like 97% isn't worth that delay. But it is an interesting thing to know in terms of vaccine distribution there. Also, the number of doses put in per vial. The Moderna is looking at increasing the number of doses it puts in each of its vials. It's been 10. But they're looking at expanding it to 15, and that is a regulatory thing normally about the number of doses you keep per vial. It's an interesting kind of very technical medical decision there because with 10 doses per vial, you have to put your needle through that rubber topper fewer times. There's a concern that if you're doing it more doses, there's more chance for that to get contaminated, for that rubber to break down from being jabbed so many times there, and the possibility for a bottle to get contaminated. But then again, if you're going through them that quickly, there's not really a lot of time for that contamination to happen. There is, however, also the concern that a larger dose per vial means there's more individual doses risk being wasted at the end of a clinic day. If they're still unused doses, it's not common for there to be, 3 or 4 doses left in a vial and no one left to give them to them. But with 15 doses, now there may be more. That is a smaller problem though, because it will make it much easier to ship and produce faster as part of the slowdown in production is just getting the actual vaccine into the vial. So a conveyor belt that puts 15 doses goes much more efficiently and we get much more doses out there. But this is a regulatory decision, so we'll see if that ends up happening. Also, the Russian Sputnik 5 vaccine released some data. This was not just the ones they were releasing by a press release. This is actually peer-reviewed in The Lancet, saying 91.6%. There has been a lot of criticism of the Sputnik 5 project for lack of transparency and cutting corners. We talk a lot about how the vaccine projects that we've seen here in the United States move very quickly, but have not have not, done anything slipshod or cut any corners. That's not true of Sputnik 5. There was a lot of things, that was a lot of criticism from the international medical community, but apparently it worked, which is kind of an awkward position there. But And it is a fairly cheap, fairly shelf-stable vaccine. That means a lot of the world can get this vaccine and distribute it relatively easily, which is great for curbing the pandemic on a global scale. Also, there has been some encouraging data that the AstraZeneca vaccine reduces transmission by as much as 2/3. This is really great news because we don't really know yet, we haven't really known yet if the vaccines will just prevent serious illness or prevent infection, and thus you could still, after getting a vaccine, get infected even though it's not causing you any problems and pass it on to someone else. So it looks like it is definitely reducing transmission by some amount. We don't know how much yet exactly, but 2/3 is the initial study number. We'll see more as more people get this shot, but that is very encouraging. And finally, Johnson & Johnson applies for emergency use authorization from the FDA. Now, this is great news to get one more vaccine out there, especially one that only requires one dose, which would make the logistics much easier. People only have to come in once. You don't have to deal with scheduling for certain time of weeks out, and just any dose that you produce is one vaccination rather than being half a vaccination. That said, Johnson & Johnson does not have a lot of supply yet. They're saying they're not going to really have more than about 4 million doses until around April. So we can't really expect to see this widespread until the spring. But that said, that will really speed up things at that time and perhaps lead to kind of a bit of exponential growth. We get more and more doses out there. The weather gets warmer. We have more vaccines available. We may start to move faster in terms of really curbing transmission in spring, which would be great. All right, and for our sources, of course, COVID Tracking Project, New York Times, mass.gov, and for more of the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.